this point in time, what we're going to do is have a look at the anterior cruciate ligament. Now we'll remove some of the fat around so you actually can see it. This is one of the common ligaments that are torn by sports people. Usually it's a fixed foot and rotation at the knee. And as you can see, the probe is just under that ligament. Now what I'm going to do is remove the probe and put it through an orthopedic test called an anterior drawer. So I'll be pulling forward to see if there's any laxity in the joint. These are the sort of tests that a physio would do on the knee. And there's not a lot of movement there at all, it's quite tight. Now when I open up the knee joint, use the scalpel. Now if it's under tension, sometimes you can hear a pop. In this case that didn't happen, but I've cut the anterior cruciate ligament right through. And at this point you can also see the femoral condyles with the articulate cartilage on the surface. Now if that actually gets worn as well, you can see osteoarthritis being a problem. Now I'll perform an anterior drawer test, and we can see a lot of movement through that joint, and actually exposing it enough to see the meniscus inside. At this point in time, what we've done is expose the posterior cruciate ligament, and you can actually see it deep within the joint. And this one is usually torn when athletes hyperextend their knee. Now what I'm going to do is perform a posterior drawer test. And if I push back on the tibia and the fibula, I can see there's not a lot of movement there. It's quite tight as exposed to the anterior movement. Now when I open it up, and we'll cut that ligament now. Now at this point, both anterior and posterior cruciate ligaments have been severed. So if I were doing a posterior drawer test, you can see there's a little bit of movement back there. There's still the integrity of muscle tissue around it that supports that joint, but as you can see, the joint is quite open and exposed.